Hi, this is Dr. Eric Thomas from Nutmeg Dermatology, responding to a recent request from a somewhat mature mother-in-law about a specific spot. Happy to tell her it was really nothing serious, and we normally barely think about these as being interesting to people in the office setting because we see so many thousands of them. But they are so common, people do have questions. And maybe you've been told you have ready for this one? Seborrheic keratosis. No, there is no common name. Many years ago, they used to be called, ready for this one? Senile keratoses. Ooh, knew a family doctor who got into some trouble. Older lady came in years ago, having been told that she had a senile keratosis. I had to sort of scrape her off the ceiling. She thought the doctor had said she was senile. Obviously not. There's an old terminology where senile just means seen in older individuals. Don't blame me, I didn't come up with that. In any event, let's go back to the correct term, seborrheic keratosis. Is there a common name? No. But when I tell people that, they go, wow, there must be a common name. So I've tried different things. Barnacles seem to work pretty well. Not bad. They occur with time. They don't slow people down much, but just as barnacles in a boat, they don't help. I like crunchies because they sometimes have a dryness to them. So who gets them? Well, they are more common as you become more mature. They're not generally, get back to that in a minute, considered to be serious, but there is a rare condition, ready for this one, called the sign of Leser-Trelat, Lesertrelat, which is said to indicate a tendency to an internal malignancy associated with the sudden onset of 50 to 100 of these lesions. Very rare. I did see someone in the hospital years ago, and although I don't think that person actually had it, I did shake up the nephrologist who had asked me to see this patient. He thought it was kind of, I don't want to say hilarious, but he thought it was very interesting since he'd never heard of it. But let's face it, most people who get these have nothing wrong with it that we know of. There seems to be a slight genetic predisposition because some people do get 50 to 100 to 150 gradually over the course of time. A specific pattern that's occasionally seen is on the back, where they kind of produce a little drooping, like a Christmas tree, or following the lines, following the rib lines. But usually they can be found anywhere. They're not really specifically related to sun exposure. They're not generally considered to be functional, although I take them off pretty readily if a person feels that they rub on clothing. If they itch, they sometimes become inflamed. Itching and a little redness can occur. So what do they look like? Well, they usually are brown. They often are, the one I just looked at was quite small, but they can get to be quite large. They tend to end rather abruptly. In other words, they're either there or they're not. And if you look very closely, preferably with a dermatoscope, which I've talked about in another talk, you can almost see little inclusions, like little cysts in it. Now, what's the risk? Well, if a person has 50 of these, it's sometimes easy to overlook a more dangerous one that is hiding among them, like the bad apple in the barrel of good apples. For example, I'm thinking specifically in older individuals, a type of true pigmented lesion that is a melanoma. Melanoma in situ, melanoma in place, shallow melanoma, called a Hutchinson's freckle. Well, it's not really a freckle, but it is dark, it's brown, it's shiny, and looking from a distance, you could confuse it with a regular freckle or a seborrheic keratosis. There are differences. Again, A dermatoscope is very useful to separate out, clearly separates the seborrheic keratosis from the other. Since they can be common, occasionally you'll see one that by sheer coincidence is associated one on top of the other, or overlapping, I should say. So, although we usually can, on a clinical basis, rule them out very quickly, again, that emphasizes the need for a full body exam, because what seems obvious to us may not be so obvious to other people. Not that anyone's 100% accurate. We try to be very cautious and err on the side of I guess safety, but on the other hand, that doesn't hurt to have someone look at your back, scalp, and other areas. So hoping that this is helpful, wishing you the best of health. This again is Dr. Thomas from Nutmeg Dermatology. Bye-bye.